So before we open it up for questions, I just want to talk a little bit about the early childhood system. I think, if we're going to try to mold the clay while it's still wet, if Dr. Dietz talked about political engagement, we learned about the HELP model from Kansas. How do you go about changing things on a national level in early childhood if these early childhood policies are setting the context for our children? And so one of the frustrating pieces of early childhood advocacy is that we don't have one early childhood system. And when we think about how to change the system, we don't really think about just changing a system. We think about changing a number of different individual policies that don't work the same way for children. And so if you think about the federal early childhood policies related to children, there are a number of them. You have the Maternal, Infant, and Early Childhood Home Visiting Program, McVeigh, which is a federal to state program that funds home visitation programs. You've got Head Start, which I know a number of you know. It's a federal to local program that has over 1,600 program performance standards, a number of them related to the health and well-being of the child. You've got the Child Care and Development Block Grant, which is a federal to state program that provides child care subsidies. And while Head Start is generally conceived of as an educational and well-being program for children, the Child Care and Development Block Grant is primarily focused on making sure that children have safe places to be while parents work. So there's a less of a health and education focus typically with child care. You've got IDEA's Parts B and C out of the Department of Education that work with children with disabilities. And then you've got some Title I money going to the schools that focus on early childhood. So when you think about how you're going to be politically engaged in helping to change the context or the settings for children in early childhood, that is what you're up against. And so when we think about how we're going to affect change, we need to be thinking about all of these different policies at the same time. And so, one of the things that was interesting about Renee's presentation is she talked about the fact that there was an issue with professional development in one of the programs. And I think, when we think about all of these different federal early childhood policies, one of the fundamental issues is that they have different eligibility criteria, they have different program performance standards, they have different expectations for what children should know and be able to do. And so when you start to think about the levers that you want to try to pull in policy within the early childhood space, you have to be thinking about all of these different levers. So in Head Start and in many states, or in most states now, they have what they call early learning standards for children, which set the expectations for the state on what children should know and be able to do. Each state has some sort of nutritional standard and some sort of health standards within those standards. You have to think about the workforce development policies within these different early childhood programs. How are we training teachers to help mitigate the effects of toxic stress? How are we helping them to build resiliency in children? That takes a lot of training. We have to think about the policies that are related to the programs. What are we asking programs to do? Head Start, they serve meals family style. They specifically work on imparting educational knowledge into children about healthy foods. How do we go about our screening and our assessment? What sort of data are we collecting to make sure that we're making data-driven decisions about this? And then ultimately, when kids are ready to enter kindergarten, what do we know about them, and what kind of data do we have available that helps us to make the early childhood system better, knowing how kids are doing when they enter school? So those are some of the things that we're hoping that you'll think about and talk about during the course of the day. I think we have a few minutes for questions if you have questions for the panelists.
So I have a question.
Panelist prerogative to ask the first question.
Okay. I have a question. Just because I'm not by any stretch of the imagination, an obesity expert. And NCCP also runs the Child Care and Early Education Research Connections Project. Anything you want to know about, not anything. There's a great deal of data about early care and education, research, data, secondary data analysis. And so in preparing for this presentation, I was looking at meta-analyses of childhood obesity prevention program. And the suggestion, so this is a question for Bill, and the suggestion is that interventions with a singular focus, whether it's nutrition or physical activity, are more likely to have an impact on obesity than those that target multiple foci simultaneously. And I'm very curious about that.
Am I on here? Is this mic on? Yes. You know, that I would have to look at that because the the guidelines for clinical preventive services from the U.S. Preventive Services Task Force calls for a multi-component family-based behavioral intervention. And part of the challenge, well, that actually I should correct myself. That's a treatment recommendation rather than a prevention recommendation. I think that there are. I'm not aware that the U.S. Preventive Services Task Force has a prevention recommendation because I think there are too few. My impression is there are too few effective strategies that we know long-term prevent obesity. So I'll have to look at that meta-analysis.
Okay, and then just one more, because just as a follow-up to this, because another meta-analysis showed that there were greater effects in weight loss compared to prevention interventions. So it sounds like that may be what you're saying. I'm not quite sure.
Yeah.
Yes, all right.
Questions for the panelists? Please.
So my question is, and I think Dr. Dietz brought it up briefly, is my concern has always been that our early learning professionals live on poverty wages themselves and oftentimes have high ACEs scores themselves. And we're looking to them to provide all this nurture and guidance to these really vulnerable children. And I feel like we're missing something in working to help our early learning professionals. And I wonder if you have any thoughts on that.
Yes, I agree. I think I can't remember who it was in the panel yesterday that focused on the stress of the providers in early care and education centers. And if they themselves have been the victims of adverse childhood experiences, that's an additional stress imposed on whatever stresses they have as a consequence of the delivery of those services. And I think that if we're going to come to grips with this in early care and education centers, one of the challenges is how do we come to grips with that in the providers within those centers. So I think your point is well taken and a challenge, and one that's probably worthwhile discussing in the breakouts.
Yes, and I would just agree in terms of, obviously, the work of the National Center is focused on the importance of a living wage, because without that, how do parents nurture children? How do workers who are caregivers for children really nurture them as well?
I want to speak to this question as well. I before I went to CDC to be an epidemiologist, I was a clinical psychologist by training, and I really think this speaks to the need for this two-generational approach because it's they should be happening together, addressing the needs of the caregivers, because it can be an incredibly healing process for caregivers to be addressing those issues with the children. It becomes one reinforcing cycle, and it affects both. So I think it's important to keep that in mind in looking at the interventions, that you don't target one or the other, but it can be a combination.
Right. Just to add to that, we can't expect caregivers to foster resiliency unless we foster resiliency in the caregivers.
And I would just add, I know it's a difficult thing to do, but when we're talking about families with young children who are in poverty, especially, but not just, but especially those in deep poverty, their source of child care is precarious and certainly often not the best. And if there are ways we can reach those caregivers for children in poverty and deep poverty, to provide them with the kind of support they need. And many of them are underground because they're not legal. So we can't say we can't deal with them because they're not legal. We have to find ways to make those kinds of inroads. And when we talk about the importance of community, that's the way in.
So if you could just, when you ask a question, say your name and where you're from so people can find you later if they want to follow.
Hi, I'm Tracy Capers from Brooklyn, New York, and I'm really interested in the notion of building community resilience and individual resilience that you talked about. Can you share a little bit more about how do you measure it, and how do you know that you're making some change in those two areas? I'm just curious.
I'm not sure. That's an excellent question. I think we can measure resilience by indirect measures like school performance or aggressive behavior. But I think that resilience can only be measured over time in terms of how a child performs on those multiple social outcomes. But others here may be more informed about that than I am, and I'd be interested, Renee, in your thoughts about that.
Well, NCCP just got a very small grant to look at resilience among low-income families, because what we've seen so far in terms of direct research, there have been a couple of projects where interviews have been conducted with parents, and using at that time an untested instrument that asked questions about family rules, about the agreement between parents about the kinds of things that are important. So about sources of support within the community, about whether you feel when hardships when you come up against difficulties, if you feel you have the capacity to address them. So it's a measure asking some questions that try to get at what families living with hardships can do to deal with them.
But it sounds to me like those are the conditions that foster resilience rather than a
Yes.
direct measure of resilience, correct?
Right, yes, that's
Yeah.
correct, but that's as much as I've seen.
The other challenge that I think we face in this field is that I don't think we have a good mechanism to identify the expression of adverse childhood experiences in early childhood. I think we can measure the conditions around it, but I don't think we know what it looks like.
Yeah. I think you're right.
The one thing I was going to say is Nadine Burke Harris has done a lot of work in this area, and looking at she has a measurement tool that I think she's going to put out publicly at some point, that looks at the number of adverse childhood experiences and uses that number then to determine, the level of maybe toxic stress. So there's that as well. It's Nadine Burke Harris.
Hi, Natasha Frost from the Public Health Law Center. I'm wondering what role institutional racism plays in this equity conversation, because we talk a lot about equity, but being from Minnesota, we've realized that it's about institutional racism when you boil it down in a lot of our policies. And so with ACEs and, how does institutional racism fit into that?
Well, I alluded to that in terms of housing policies, and there's some good examples in Chicago and Baltimore where there has been a deliberate effort at the state and local level, both regulatory and legislative, to limit housing outside of specific communities, with deliberate exclusion of African Americans from the broader culture. And this, if you look at there's in one of the pieces that I read, there's an assessment of integration and diversity and cities like Chicago and even Washington, D.C. Score very low on those scales. And that's the best example I have of institutional racism, that we tend to think of these communities as just out of the blue generating these adverse childhood experiences, when in fact there are several legacies which have fostered those, and those are not just immediate legacies, but historical legacies. And I think we're seeing those play out in a number of communities, most notably and most recently Ferguson, Missouri.
So, hi, Linda Doctor from the Kellogg Foundation. So I think this is a question for you, Renee, but open to Bill, your thoughts too, and Jeff. So all three presentations were great, so thank you very much. Always expanding thinking. Because of the racial inequities in the early childhood system and all the related systems, what is going to help move this conversation so that the narrative changes, which will then result in different practice, different policies?
It's a good question. The racism and the inequality is pervasive, and it's denied, it's unspoken, but we know, and it's unacknowledged, but it's difficult to prove, but we know it exists. And unless we, those who are in a position to have a voice to call it out and to call for change, then nothing's going to change. And I think a prime example of that is, would you have thought even, 2 years ago, that there would be the kind of groundswell about increasing the minimum wage that there is? I think maybe 2 years ago, people were like, that's ridiculous. That is never going to happen, and it has. So I think that kind of movement requires the voices of all of us to be able to make a change.
I think that that we face an important challenge in redefining the contextual framework for the behaviors that we're seeing in adverse childhood experiences. The system, and there's a very pertinent article that was just in last week's New Yorker by Jill Lepore, who talked about how states and communities have responded to child abuse, and most particularly child deaths, while under control of the Department of Children and Families in Massachusetts. And it makes the point that the focus has continually been on the individual family without understanding the context in which that abuse has occurred. And that's proved and may prove to be the best defense for parents who have been engaged in that, who are themselves victims. And although that doesn't relieve them of the culpability of child deaths, it does put it in a context. And I do think that other legacy that I mentioned, which was the shift from investments in early school or preschool child development to a focus on the abused child, really changed things in a very damaging way to families. Had we invested in child development, I think we would have had much different outcomes.
I would just say also that the early childhood community needs to get better at advocacy. I think coming out of the the private sector and being able to be side by side with major corporations doing their advocacy work and doing their lobbying, and seeing that they have experience centers within 500 feet of the Capitol where they take members of Congress through and have them fly flight simulators to say, look at this great technology we have. This should be in every plane in the United States. We need to get more sophisticated in our advocacy, and I think that will help us.
It occurs to me that we need to make the business case for investments in this field, and I think that's we know about early care and education, but I don't think we know about how the ultimate costs are of the kinds of adverse community experiences that we pointed to.
Yeah, and I think focusing on opportunity as opposed to inequality might open some people's ears to it that are closed to it now.
Good point.
Just a much clearer narrative, I think, is really important, because if you look at sort of what the early childhood community is doing, they talk about quality, they talk about return on investment, they talk about brain development. There are all of these different pieces that we haven't, I don't think, done a good job weaving together into a coherent narrative that will sort of, move policymakers to do something.
Hi, my name is Bonnie. I'm in Arizona, and I thank you for the good conversation here this morning. And I've been listening and thinking, and it seems like that we just lack maybe the political will or the the consensus, across the country from both sides of the aisle to actually make the right decisions. I mean, I think the science has proven quite a bit over the years. You just mentioned brain development, and we know a lot of things that prevention policies, we understand that there's an economic benefit. You referenced, back to the 1970s. I don't remember what the act was called, but it seemed like it was kind of close to, coming to fruition, and then it didn't. I'm just wondering if there's something that, or I guess a question is, do you think there is the political will on both sides of the aisle to do something about this? I mean, in my state, it's very conservative. And, we have a lot of people who think moms should just be home with kids. And, the reality is we need good quality care for all kinds of kids and parents to be able to make choices. And parents and staff, through their low wages, can't pay, for good quality. And we can't expect the government to pay for everything either. I mean, it has to be a blending of all of that. And I'm just not sure we have the political will and how to get that, for all of our benefit, for future workforce.
Renee and I are looking at each other to see who should take this on. I think, I think we've gone from a war on poverty to a war on the poor. And I think part of the challenge is, I think poverty is too big a lift. And I think we have to break it down into smaller pieces. And I agree with you that we don't have the political will to do that on the issue of poverty. And I'd be interested in Renee's take on that. But I do think that there are clear initiatives underway in a variety of cities that focus on elements of that. The living wage, homelessness, children and families are I think, cogent issues. But I think this is, I also don't think that we can look to federal solutions, at least for the very near future. I think that the Congress is so divided that's not going to happen. But are there things that we can do at the state and local level to begin identifying examples of strategies that work with defined outcomes as the step in that direction?
And I think you're absolutely right, and that's why much of what we focus on is states, what's happening at the state level. What do the data tell us about children all across the United States, so that we can look at what seems to be working, because that's where you're going to see the innovation. And I think that, unfortunately, the speaker is correct in that sort of this issue of the deserving and the undeserving poor that's been with us from Victorian times is still with us. I mean, children are poor through no fault of their own, so they deserve our support. But their parents, adults, are responsible for the sorry situation they're in, and so they have to deal with it as best they can. They're uneducated, they're criminally inclined, they're culturally deficient, they're reproductively prodigious, they're financially inept, and that's the message that we hear. And unless absolutely we can change that narrative and show that with opportunity and with the kinds of innovation that is taking place in small pockets, we are seeing progress, and that's what we need to lift up and advocate for.